We hear all the time of medical breakthroughs. In fact, we often talk about them here on Delmarva Life.
It amazes me sometimes just to stop and think how many things have been discovered, changed, and ended just over the last few years.
Yeah.
And we always get excited when we hear of the hope that modern science can offer, especially when it comes to cancer. Now, one of the latest breakthroughs deals with brain cancer. Now, we've been hearing a lot about the disease recently after this young lady, 29-year-old newlywed Brittany Maynard, was diagnosed with terminal brain cancer. That was done this last spring. Now, she's planning her own death on her own terms with a lethal medication before, she says, the cancer destroys her. Brittany wants to make it to November 1st. She's afraid, though, she may pass away before then. Now, Brittany's not alone in her fight. The American Brain Tumor Association reports that for every 100,000 people in the United States, about 221 are living with a brain cancer diagnosis. After leukemia, brain tumors are the second leading cause of cancer-related deaths in children under the age of 20. The association also reports that brain tumors are the second leading cause of cancer-related deaths in men between the ages of 20 and 39. They're also the fifth leading cause of cancer-related deaths in women who are between 20 and 39. But now, a new tool in the fight against brain cancer, and we have this guy to thank. This is a death stalker scorpion. It is the most toxic scorpion on the planet. Scientists discovered the scorpion's venom attached itself to cancerous cells in rats, so they used the venom to make something called tumor paint for humans. The paint allows surgeons to spot cancerous tissue during surgery. It becomes fluorescent under laser light.
The surgeons can see, as soon as they open up the cavity, they can see what is cancer and what is not cancer. It makes the cancers light up a different color than the rest of the body. So when it binds to the cancer cells, it gets flipped inside the cancer cells and makes them light up so that surgeons can see them in real time while they're operating.
Okay, so get this. The idea for tumor paint came after a 17-year-old girl underwent a 17-hour surgery to remove a tumor in her brain. Surgeons were unable to remove all of the cancerous tissue because some was hidden behind perfectly normal brain tissue. Now, the FDA has approved tumor paint for study in human trials.
That is just fascinating.
Incredible.
Using venom from the most toxic scorpion on Earth to heal.
Yeah.
Unbelievable. Well, those affected by brain cancer call it a whole new world for cancer. Now add something else to that list, but this one involves breast cancer. You know, most women who develop breast cancer have no family history, but there's a new test that can more accurately evaluate a woman's risk of developing sporadic or non-hereditary breast cancer, and it just may end up saving lives.
1 of every 8 women in this country will develop breast cancer, but only 10 to 15% of those cases will involve a family history of the disease. Now there's a new and affordable test for the 85% with no family history. It's called Brevaginplus. Using cells from a simple cheek swab, Brevaginplus looks for patterns in a woman's genetic code. These so-called SNPs are associated with a risk of sporadic breast cancer, the most common kind.
Offering a test like Brevaginplus is one of the most wonderful things that we have going for us right now, because it allows us to identify a whole group of women that we didn't know had risk factors before. We can help to prevent more than 50% of those cancers by giving medications, which are commonly available and very easily taken. We can talk about lifestyle adjustment and certain factors that a patient has control over in her life, such as her diet and her exercise. And we can also use different types of imaging and more frequent examinations.
Brevaginplus also considers clinical risk based on the patient's age, when she got her first period, when she had her first child, whether she's had breast biopsies or a family incidence of breast cancer.
Brevaginplus is a very affordable test for most women. Most insurance carriers will cover this. For those who don't, the most it costs a patient is a few $100s. The test is appropriate for most women over the age of 35, and that would apply to Caucasian women, African American, and Hispanic women, women who have some degree of risk factor, or maybe even none.
With information provided by Brevaginplus, women can then work with their doctors to better manage their risk of developing sporadic breast cancer, including using a personalized breast cancer risk reduction and screening plan. To read more about Brevaginplus, go to our website, wboc.com, click on our picture at the top of the page.